So continuing with our tour through the cranial nerves, we did 1, 2, and 3. Do you remember them? What was 1? Olfactory. Was it sensory or motor or both? It was purely sensory. How about 2? Optic, purely sensory. 3, what was 3? Oculomotor, move the eye, as well as the upper eyelid, all right? And then also involved in accommodation and pupil constriction. So it was motor, mostly. And now we're on to cranial nerve 4, the trochlear nerve. Trochlear nerve is yet another nerve that has a little bit of sensory function, but I want you to think of it really as a motor nerve. It's also an eye movement nerve. In this case, it's the only cranial nerve, by the way, that exits from the dorsal side of the brainstem. When you're trying to find these on the brainstem for the lab, all the other nerves come out the anterior side of the brainstem. This one is the one that comes from the back and then wraps around to the front. That'll be an easy way to identify it for a lab practical. It only innervates the superior oblique muscle, all right? So only one of the 6 muscles that moves the eye is innervated by the trochlear nerve. And once again, if you impairment to this nerve can result in diplopia, double vision. If your eyes aren't focused on exactly the same thing, then your brain gets 2 separate images. That's diplopia. And why is it called trochlear? Well, because the term trochlear comes from the Greek word trochleia, means a pulley. So the muscle, the superior oblique muscle, it comes off of the eyeball and then it goes through a little structure called the trochlea, which is there in your orbit, all right? And so because it goes through that, the people who first named these things said, oh, it's like there's a little pulley, so they called it the trochlear nerve. See, isn't that cool? That might be a Final Jeopardy question. If it is, and you win $50,000, I want 10%, okay? So again, controls superior oblique muscle, which passes through the pulley-like trochlea. All right? All right, 4 cranial nerves, over and out. Let's move on. Number 5. 5, the trigeminal nerve. Ooh, this is a big one, okay? It's the largest cranial nerve, and it's both sensory and motor. This is the first one we've seen that's both sensory and motor, okay? Now then, it has 3 divisions. That's called the trigeminal. The ophthalmic, maxillary, and the mandibular, all right? Where does ophthalmic go? It goes up to the eye, maxillary, and down to the mandible, mandibular, okay? So it's easy. Now, the sensory portions of the trigeminal carry impulses from the tongue, eyeballs, scalp, nose, teeth, ears, and other portions of the head and face. So, really, the trigeminal, when someone touches your face, that's the trigeminal nerve that's letting you know. And that's why, again, a diagnostic test for the trigeminal nerve would involve touching the face and saying, can you feel this? Can you feel this? Can you feel this? And notice there are the 3 branches, and we'll see coming up. You can actually then determine which part is impacted according to where they can and can't feel. You can actually track down not just that it's a trigeminal nerve problem, but you can actually identify which branch is having the problem, okay? And then the motor portions, these are temporalis, masseter, and the pterygoid muscles, which are involved in mastication, chewing muscles. So there you go. Once again, trigeminal is our first cranial nerve that's both motor and sensory. Sensory, really facial sensations. Motor is in large part just chewing, all right? These are the chewing. So remember, the pterygoid comes from the pterygoid process, pterygoid muscles, the pterygoid processes of the sphenoid bone, okay? And then the temporalis muscle. So there you go. These, and then the masseter, okay? So the chewing muscles, all right? That's the trigeminal. Inflammation of trigeminal can result in what's called trigeminal neuralgia or tic douloureux. And there you see, by the way, looking in the diagram, you can see the testing in the upper right. There's the innervation of the ophthalmic branch, of the maxillary branch, of the mandibular branch. So again, doing a test, if they can feel up by their eye, they can feel down by their chin, but they can't feel up by their cheekbone, well, something happened to their maxillary branch of the nerve. Now, this trigeminal neuralgia is a big deal. Causes excruciating pain, sometimes known as a suicide disease, because people say it almost drives them nuts. It's one thing if like your foot hurts. We kind of feel like, we are not in our foot, but we kind of think of we as being in our head. And so trigeminal neuralgia, you have this intense pain in your head, and people say it feels like you can't get away from it. It's just like they want to like run from the pain or move the pain away, and you can't because it's inside of your head. Is where you feel it. So, yeah, it's a serious kind of a thing. And one of the causes that I read about was somebody got a tongue piercing, and they went right through the lingual nerve, which is comes off of the mandibular branch. And that person ended up with trigeminal neuralgia for a considerable amount of time afterwards, all right? And the onset of it is crazy. People say it's like, everything's going fine, and like suddenly they're walking down the street and they just turn their head and like the wind hits their cheek, and suddenly it starts an attack of trigeminal neuralgia. These attacks like come and go. So you can read more about that on your own if you want to. It's very interesting, but it's a serious thing. It's really it's an incredibly painful condition. Now, dental anesthesia involves, the alveolar branches. Remember the alveolar processes that the teeth fit into? They fit into the sockets, and the processes were on the maxilla and mandible above them. So, look in that diagram in the lower left there. You can see when the dentist goes in there with a needle and sticks it into the back of your mouth, what's going on? They've got like, lidocaine or some other, local anesthetic. They're all, one of the best ones I remember, a dentist had one called Hurricane because it worked very fast. So, but yeah, they're all just a local anesthetic. They block sodium channels on the axon, all right? They block voltage-gated sodium channels, so basically no pain signals can make it back. But what they're going to do is, if they're going to do work on your upper jaw, then they stick the needle in there, and they inject the anesthetic, and then it just diffuses throughout the whole area, and then it gets to where those axons are, and it blocks all the voltage-gated sodium channels, and no pain. And of course, in the lower jaw, notice that the mandibular, like I was just mentioning, the lingual nerve, which goes through your tongue, comes off of the mandibular branch. So what happens when you get dental work done on your mandible? Oftentimes that not only numbs up your gums, but it leaves your tongue numb as well. That's why you can't talk very well afterwards, and people make fun of you because you sound funny. So, another interesting consequence here of trigeminal nerve stuff is shingles, painful skin rash, caused by varicella zoster, the virus that causes chickenpox. So, interesting what happens here is following remission of chickenpox, the virus basically hides in places like the trigeminal ganglion. Viruses, sneaky little things. And then what happens is later in life, this normally shows up, shingles, people like over the age of 50, they recommend you get a shingles shot when you get to 50 or wherever. I don't remember. I got one. But your immune system kind of starts weakening and wearing down as you get older, and that's when the virus goes, all right, you guys, here we go, come on out. And that's when shingles emerges. So, again, typically in adults over the age of 50. You can see sometimes shingles very mild. You can see the left, or sometimes it can be horrific. Let's see, my mom's, God, how does this work? My mom's mother's sister's daughter's husband. I don't know what that is to me, but he had really bad shingles, and he was really in bad shape for like a month or more. So watch out. When you get old, get a shingle shot. And what am I talking about here? In my world, Slurpee is the sun. Brain freeze. Yeah, it's trigeminal nerve involved in brain freeze. It's that maxillary branch. So when you get that Slurpee up there against the roof of your mouth, the trigeminal nerve basically starts going, hey, what the hell is going on here? That's cold. And so it starts sending intense screaming signals to your brain, and of course, you just stick your tongue against the roof of your mouth or your thumb or whatever, it warms it up, and then it goes away. And there's trigeminal neuralgia. Again, it's a big deal. People who have it, they say it's a big deal. All right. One on the right is a woman. She was an artist, and she has trigeminal neuralgia, and she tried to depict visually what it was like when she got an attack of trigeminal neuralgia. Doesn't look like fun. Okay, and then Cranial Nerve 6, we're halfway through. The abducens. Now, what does that word look like? Doesn't it look like abduct? Because that's what it does. It abducts your eyeball. See how easy this is? So once again, it's mixed, but mostly motor. Has a little bit of proprioceptive function. You can think of it kind of like, remember, what were the two other nerves that move the eyeball? I'm going to recommend strongly that you make a little list of cranial nerves and group them by function, like which cranial nerves move the eye. All right, so already you would have 3, 4, and 6 on that list. Carry that around with you and study that, and I think that's the way to do it. Group them by function. That'll help you remember better. I'll try to keep reminding you. So the 6th muscle, the one we haven't talked about so far, the lateral rectus, this is the one that moves your eyeball laterally, and that's why this is the abducens nerve, because it abducts your eyeball. Impairment of abducens, again, can result in diplopia or strabismus. And the name abducens comes from the same root word as abduct, because it's moving the eyeball away from the midline. So there you are, boys and girls. We're halfway through. We got one more PowerPoint to get through the rest of them.